7 Botox mistakes. Do not make these common mistakes after getting your Botox. How do you make it last longer? And I'm also going to tell you how you make it safer. You may not be happy seeing lines and wrinkles as you age, and so many of us turn to Botox to help with the fine lines and wrinkles. 2 things of note before we dive into this video. Number 1, Botox does not build collagen. It slows down muscle movement. So if you only do Botox and you don't pay attention to collagen building treatments that I talk about on this channel, one day you're going to be crying because it will stop working, because you need support of the structure so that when you slow the muscle down a little bit, the lines don't form. Collagen building is key. All Botox does is slow down the muscle movement, does not build collagen. Number 2, Botox is a brand name. There are hundreds of different ones around the world. When I'm in different countries, there's a plethora of Botox-like products. In the United States, Botox, Dysport, Jeuveau, and Xeomin are common ones, and now Doxify, the one that says it lasts 6 months. So 3 to 4 or 5 months is about normal for these, but the more collagen you have, the longer they last. So you took the plunge, you got it done, or let's say you're just seriously considering it. This video will help. You've just spent a ton of money on a procedure that isn't going to last you as long as you want it to. We all want it to last longer if we like it. Number 1, working out immediately after the procedure. One of the most common things I get asked. Working out after Botox is a big no-no. When you exercise, you strain your muscles. It causes them to contract, it heightens blood flow, and it causes increased washout in the area where you had the treatment. So you don't want to do that. What do? Avoid strenuous activity for at least 24 hours following the procedure is what I generally recommend. Low cardiac workouts after 4 hours are okay, say weightlifting, but you don't want anything that's going to increase your blood flow. Your best bet is just working out the next day. That will be absolutely fine. Take a lazy day and just chill out. Go get your hot yoga tomorrow. Number 2, getting a facial or other beauty treatment. So facials are the most common thing because people make a day of it. Oh, I'll go get my Botox done, then go get a facial. You want to wait 1 day. Let's talk other procedures, RF microneedling, chemical peels, and so on. Often I combine things in the same day. If you're talking a chemical peel, I do that first, and then I do the Botox injections. I use much more Dysport than Botox. If you're talking RF or heating devices, HIFU, Ulthera, again, you can get it the same day. You do your heating first and then cool down for 15-20 minutes and then get your Botox injections. What about microneedling, derma rolling you're doing at home? Wait about 24 hours is safest. Unless you're in a medical facility, then you can do it first and then treat. It will depend on what you're infusing with the microneedling, what your slip is. But in general, wait 24 hours for those. If there's other treatments that you are combining that you want to know about, ask me in the comments section below and I'll respond to those. Fun fact before we go on, Botox was initially used to treat strabismus. That's a condition where the eyes are malaligned. They're misaligned. They don't point in the same direction. In the late 1980s, ophthalmologist Dr. Gene Carruthers, who I know up in Canada, Vancouver, British Columbia, discovered that injecting Botox into the muscles around the eyes could temporarily paralyze them. But guess what else it did? Paralyzed the muscle that causes crow's feet. And that is how Botox was invented, for all of you out there that were wondering. Number 3, consuming alcohol. One of the most common mistakes that many make after getting Botox is consuming alcohol. There's a greater chance of bruising surrounding the injection sites. Not only should you avoid the alcohol beverages following the procedure, but it's also, I recommend, stay away for a few days before. 4 or 5 days before is more important than the day of because you thin the blood before you're coming in. It's less important drinking within an hour or 2 afterwards. And I know all these Botox home parties, people are drinking at the same time as they're getting it. I've seen it before. Comment on that below. Also, alcohol dehydrates. And if your skin's already dry and cracking before the procedure, the Botox is going to exacerbate those fine lines and you'll be unhappy with your result. Number 4 is smoking or vaping. Now, you probably already know the dangerous side effects of smoking and vaping, but nicotine causes collagen to deteriorate. It ruins the skin cells and prevents Botox from doing what it's meant to do. When you smoke, it causes fine lines to form around your mouth and your eyes, and that's the first place that people come to my clinic, around the eyes, around the mouth. Once those lines are there, especially the mouth, they're often there for life unless you go deeper and get something like CO2 lasers, plasma fill, erbium YAG, intense lasers that are going to build your collagen. Now, quitting smoking, I know it's easier said than done. Nicotine is highly addictive, but if you really want to smooth your skin and get a youthful look, it's imperative to stop. Remember, get your house in order before getting any invasive cosmetic treatments. That means sleep properly, exercise, and eat real food. Those are key. Number 5, sleeping on your face. Yes, something as simple as sleeping on your stomach can counteract the effects of Botox. Now, it's more important if you've had it done that evening, within 3 to 4 hours. Botox binds the receptor within 1 to 3 hours, but some people get their injections at night. In fact, sleeping on your side can do the same thing because you're smushing and you're crunching down on the most important area of injection that can lead to the drooping lid. That is right above the mid pupil. So you want to try and sleep on your back as much as possible. And if you can't do that, you want to consider maybe getting your injections in the morning or early afternoon. That way you're not getting them and going straight home to bed. Silk sheets do help. They help prevent the face getting stuck down and putting pressure in one area. So I do recommend that. I get it. It can be challenging to control your sleeping position. I am certainly a side sleeper, so I get that. I often give my patients my Sleep Extreme vitamin for the first evening after they get their injections. It puts them in a deeper sleep. They can then sleep on their back and they get a better sleep overall. Number 6, wearing makeup. Another common mistake women make, mainly after getting Botox, is applying makeup and skincare products too soon following the procedure. For a majority of patients, the injection caused a little bit of redness in the face, a little bump, and you might be tempted to conceal that with foundation or concealer. Now, it's a good idea to wait until the next day, until the injection sites have healed properly, because a lot of skincare, people hang on to it for a long time, and it has bacteria. If you're using older skincare, and I know many of you share your makeup products, your brushes and so on, and you don't want to get infection. So you want to wait until the area has healed up to wear. Now, used to be a bigger problem because people did not want the stigma of having lumps or bumps around. And so immediately when they walked out of the med spa after getting them, they put concealer on. Now it's almost a badge of honor. People don't mind. In fact, they love the fact that people know they're getting these treatments. It's almost like you're getting something elite that's not for everyone. So people who get these treatments are now revered. This isn't a big problem. But they also did what? Number 7, they used to rub. I'd be in the clinic. This is 20 years ago. They would rub those little bumps out. They would massage the area that they got their treatment. Your injector knows exactly where they're putting it. I don't want you to massage. Too much pressure in the area can spread the Botox to other areas of the face. You want to avoid that at all costs, especially around the eyes, again, where you can get above the brow and below the brow. If the injection is at the wrong depth, you can get that lid droop. Now, it's not permanent, but it's not good. So you want to avoid rubbing or massaging that. Usually, again, 4 to 6 hours, but 24 hours is best. Now, you want to watch this video so you find out how to build your own collagen, which is the ultimate way to make your Botox last longer.